Thanks, Caroline.
Yeah, thanks, Ollie. So I'm Caroline Hart, one of the other directors at Peak Health Coaching. It's lovely to be with you all this afternoon. So thanks very much to those of you who did complete the pre-conference survey. Just going to give you a few little snapshot insights from that. So in terms of current role, a bit of a mix of roles. So quite a few people in that kind of work-based health and wellbeing coach type role, others of you in work-based support roles of different kinds, also some managers and administrators, and then we just had one person in a kind of an other healthcare professional role. And I'm sure there's other diversity of roles out there as well. As I say, it's a snapshot from 23 people who completed the survey. So, who's using health and wellness coaching skills already? Well, happily, I can report that just about two-thirds of you are currently using health coaching skills in the work that you're doing. A couple of people weren't quite sure, and I guess that's because there's maybe some things that you're doing that actually are health and wellness coaching skills, but you don't necessarily kind of know it, and other people who are not on board yet, but hopefully will be kind of looking to kind of move in that direction. So, in terms of how easy is it to apply these skills, I thought this was a pretty good response, really, kind of an average rating of 3.47, which is kind of, I don't know, it's kind of circa 70%, if you like, of people saying that they found it kind of at least moderately easy to apply health and wellness skills in their role. Then, in terms of how effective do you think health and wellness coaching skills are in your work context? Again, I thought pretty good rating here. So, kind of, if you like, just over 70% thinking that it was reasonably or very effective in supporting the people that you are working with. So, that's pleasing to hear. Be good to sort of dig into that a little bit more later on, which we'll have opportunity to do. And then in terms of kind of coming to sort of some of the barriers, so I guess this is part of the meat of the day, really, is thinking about the barriers and enablers to implementing health and wellness coaching in a work context. So time was one of the bigger barriers, and again, it'd be great to sort of hear a bit more about that. So whether that's people not having dedicated time or feeling that when they are working with people, it's kind of more snapshot, brief intervention than those sort of longer conversations that you might prefer. Quite a number of people saying they didn't feel skilled or confident enough yet in techniques. And then again, you can sort of see there the kind of relevance, sometimes not necessarily feeling that it's the most relevant intervention for people, or that there might be some resistance from the people that you're offering the support to. And yeah, a few other people other sort of comments there, but that's a general picture. In terms of enablers, biggest enabler is seen to be more training in health and well-being coaching skills. So I guess that's something we can help with. But other providers are available, should I say? So yeah, recognizing that actually, health and wellness coaching is an emerging discipline, as if you like, a profession, is professionalizing, and people recognizing that training is quite an important part of that. So there was some other comments in terms of what you're hoping to get out of the conference today, and Ollie's spoken to this a little bit already in terms of the agenda. But I did think it was useful just to kind of pick out some of the kinds of health conditions that you've been mentioning. So people have talked about MSK, working with people with autism, people living with stress, depression, anxiety, different kinds of neurodivergence in terms of the kind of, if you like, health and well-being conditions. I think that's quite interesting because you'll have seen in the Mayfield report that actually, particularly for younger workers, mental health is a big issue, and for older workers, MSK is a big issue, the kind of musculoskeletal kind of conditions that crop up. So I think what's being said there resonates. Several of you are looking for more tools, strategies, and resources, and naming some specific things like motivational interviewing, different kinds of coaching models to support you with the work that you're doing. So, be interesting to hear how that resonates with other people as well. And then a few comments really just around the sort of, again, the training needs, this kind of desire for more formal training, learning different kinds of skills, knowledge, and tools to be able to support people, and just recognizing, I suppose, the journey that we're all on in terms of upskilling the workforce to be able to support colleagues around health and wellness. And I guess it would be useful to think around what are the multitude of roles in which people can apply health and wellness skills. So does it need to be a dedicated role, or can it be part of a wider skill set of different kinds of employees and managers? In terms of further professional development in health coaching, I think this is probably a managerial comment here about understanding how we can better support or upskill coaches. And then the second comment there looks like that's from an individual wanting to understand more about how can I progress in my health and wellbeing coaching career. So that's, from getting out the starting blocks and getting going to kind of what's perhaps the kind of longer term vision and higher level of skill. And again, certainly something that we could talk about. So just to kind of wrap up then, in terms of impact of health coaching approach, it was really great to kind of see positive comments coming through. And I really love this first one, where somebody said it's shockingly very effective. On the initial phases of the 4-day training, kind of wondering whether it would make any difference, but then realizing that coaching is amazing, and having seen it work firsthand. Certainly at Peak, we have a lot of case studies that really do demonstrate some of that value that comes back from implementing health coaching approaches. So just a couple of other comments there, but again, people commenting on how they've seen it empowering, and leading to kind of successful outcomes. So some positive news to finish on there. So, but I thought I'd keep it